I literally thought that I was not going to be normal again.
Yeah.
I literally had lost hope. I literally had been spending the last few months just laying on the couch, just in pain. My symptoms got even worse than they were before. Migraine headaches, insomnia, just horrible shaking, and anxiety. It was just awful. And whenever my C1 would go out, I would literally feel, I know it sounds, I would literally feel like I was going to pass out or black out. My son's been telling me for a long time that he just wants his mother back because I used to be just so happy, and pain really changes you.
Yeah.
And he told me after he left, he was almost in tears, and he said, "I'm so happy I've got my mom back."
Yes.
So
that's amazing. Hi, and welcome back. It's Dr. Brian Hutchison with the most special guest of the hour, Shannon. So Shannon, thank you so much for joining me today and for being willing to share a part of your story.
Pleasure to be here.
Yeah, and so Shannon, I just want you to tell a little bit about your journey. Tell us about the last 3 years, how you were functioning, high level before that, and just kind of what's been going on.
Well, it probably goes back more like 10 years. About 10 years ago, I started with getting migraine headaches, TMD or TMJ, what more people call it, and insomnia. I was treated with triptans, which kind of controlled my migraines, but I would function through it. Became a realtor, high functioning, high stress, but I would power through. Then about last year, about June, the migraines got a lot worse. The triptans didn't help them. I finally saw a neurologist. Nothing really helped. I went to a chiropractor, just a regular chiropractor that did the neck cracking, but he did do an x-ray, and it showed that I had multiple whiplashes and that my C1 was out. I did get a little freaked out about having my neck cracked, so I started doing some research on upper cervical chiropractors, and I found one, and he did adjustments, and my migraines did get a lot better. However, I couldn't hold my adjustments. I was having to go twice a week, and it's relatively expensive. I did it for several months and still couldn't hold my adjustments. A few months ago, I stopped going because of the cost. I thought maybe it was my supplements or something I was doing instead of the upper cervical chiropractor. Well, I was wrong. I started going to a regular chiropractor with the cracking, and I started getting worse. Then a couple months ago, I started going back to an upper cervical chiropractor who did all the imaging, and of course my C1 was out again and couldn't hold my adjustments. My symptoms got even worse than they were before. Migraine headaches, insomnia, just horrible shaking, and anxiety. It was just awful. And whenever my C1 would go out, I would literally feel, I know it sounds, I would literally feel like I was going to pass out or black out. It was awful. Mother's Day, for instance, my kids were over, and by the time they left, my whole body was shaking.
And that was just this year, right?
Yeah, this year, May 12th.
And it's June 4th today.
Yeah, June 4th.
That was before you made it here.
That was before I made it here. So I'm on all these Facebook sites reading about instability, neck, everything. Didn't know what to do. I'm just basically praying to God to send me to the right person. And so I had looked up all these clinics, of course, prolotherapy, PRP injections, and of course they're very expensive. Surgery, which from what I heard from most people was touch and go, and of course last resort, So I just kept praying and praying, please God, send me to the right person. I mean, back to Mother's Day, I literally, which was just May 12th, a few weeks ago, I literally was to the point where I was shaking so bad, I was praying to God just to give me the strength to get me to the doctor, to be able to get me to drive to the doctor.
Yeah.
I was that bad. I mean, just shaking uncontrollably.
Yeah.
Somehow I found you on one of my Facebook groups and made it to your office, and we had, I think, the first week was 4 days.
Mm-hmm.
First day was, of course, the diagnostics.
Mm-hmm.
And then we started with the dry needling the second day. I went home that weekend, and even though I didn't feel perfect, I did housework. You know, I mean, my husband had been doing it all. I literally had been spending the last few months just laying on the couch, just in pain,
Wow.
just in horrible pain. And so then I came back the second week, 5 days.
We put you in weights too during
The
that
weights,
first week.
yeah, you fitted
had
me
you.
for weights, which I've been doing. We did a curve check last week, so it was determined that my neck, I had, what do we call it, text neck, or, you know, so I've definitely been having incorrect posture for years. Always, you know, I've always had sitting jobs, you know, looking at computers,
Yeah.
looking down. Like I had told you, I incorrectly thought that the opposite of forward head posture was kind of doing the crane position, which, like you said, was worse.
Yeah.
So I had just been doing horrible things to my neck. So in addition to having C1 misalignment, my neck was straight or miscurved.
Well, you had a really, really significant kyphosis, or a break forward in the middle of your cervical spine.
Mm-hmm.
And right at that C4-5 segment where you had the break forward, you also had some anterolisthesis, or like a flexion instability.
Mm-hmm.
I think that the position that you were trying to get in, Shannon, if you kind of showed it a little bit, but it was, you were using some of the advice that, you know, is more old-fashioned, but you know, people would say just pull your shoulders back and look up, kind of.
Mm-hmm.
And so you were, in your scenario, this was putting your C1 further forward. It was hitting, we showed on an image what it looked like, but your skull hits into your posterior arch of C1 when you're doing that, and you were just irritating more and more of those chronic headaches and increasing the anxiety. And so it wasn't really putting you in, and then we changed that posture, right? And I know that it's hard to get it exactly right, and there is no one size fits all. So each individual should be examined, you know, as an individual. However, as a general rule of thumb, what we're seeing is that it's better to have a bit of a wider scapula and kind of letting your shoulders gently not get pulled down and back, but just a little bit up and out, and trying to draw that lower neck in without forcing. You're not doing a hardcore chin tuck. It's just kind of drawing that lower neck in and trying to get out of the, you know, rat race of being here and pulling backward and being in this position. Usually we're seeing time and time again that's contributing to blocking internal jugular vein drainage, maybe irritating vagus nerve.
You could see that on my left side.
We could see it. It was much worse on that left side. And as soon as we started to get some of the pressure off of there, I mean, how about that anxiety change? That was one of the first things.
It was one of the first things that changed. Yeah.
That
which
you
is
noticed.
amazing. I almost think that was worse than the headaches.
Like, you came in the first day, your husband Ron was sitting right in the chair I'm sitting in now, and you could tell, like, you know, you were, you know, asking, you know, way more questions, like about little things, and just, you know, you were so nervous about your health. And it was like, I don't know, it was day 2 or 3, you came in and there was just like this clarity to the eyes, and you were relaxed, and it was pretty neat to see.
Literally, I'm not trying to exaggerate, I literally thought that I was not going to be normal again.
Yeah.
I literally had lost hope.
Yeah.
So.
Yeah. And you know, it's pretty incredible, because remember, this was less than a month ago that you had Mother's Day, where you couldn't be who you wanted to be for your family, where you were having, your body was shaking and you could barely make it through the dinner together. And just last weekend, which today is Tuesday, on Saturday you hosted your son over and you guys had a barbecue, and like, tell me how that went.
It went great. My son's been telling me for a long time that he just wants his mother back, because I used to be just so happy, and pain really changes you.
Yeah.
And he told me after he left, he was almost in tears, and he said, "I'm so happy I've got my mom back."
Yes.
You know, so
that's amazing.
So it made me feel really, really good.
Yeah.
You know, because it really does change you. And I hated that, you know, you can't help it when you're in pain.
Yeah.
You really turn into a different person.
Yeah.
And I really had lost hope. I really didn't think that I was going to be myself again. You know,
Wow.
You just feel that way when you're in pain constantly, and your body's just out of control. You just You know, when you have that, you know, constant headaches,
Yeah.
your body just shaking uncontrollably, and just that feeling of,
Yeah.
you know, it's just indescribable.
Especially if you can't get relief, you know.
Yeah.
If you go through it for a couple of days and then you have a week or two that's good, you can kind of, you know, but when it's just all the time, it starts to really...
It was constant. It was constant. It was constant. And like you and I discussed, I haven't, what is today? Is it day 12?
I think it's day 12.
Yeah. I haven't even had to take a triptan for a migraine. I'll occasionally have a little throb in my head, and then it'll just go away. You know? So I haven't had to take a triptan for migraine sufferers. You know what triptans are, you know, you have to take them for migraines, and insurance only gives you 9 a month, and I'm on day 12 and haven't had to take one.
That's incredible. And you said you couldn't remember the last time you went 5 days without it. And we've been counting the days.
Yeah.
It's like each day you came in, you know, we're thinking, did you have to take it? Did you have to take it?
And I was having ice packs, you know, I would have those these little ice pack head things, you know, in my freezer. I have 3 of them, and I was constantly rotating them. I haven't had to use one.
I haven't had to use the ice pack. And, you know, you had just like this incredible anxiety. You said it was like an 8 out of 10 or 9, and it's gone. And then you had this debilitating headaches and head pressure that was an 8 or 9, and at worst they are 2, maybe you said.
Yeah, and they don't last.
And they
it's
go
like
away.
They almost go away. You know, they just go away before I can even think about it. And I haven't been able to use ibuprofen because of the dry needling. And I was on ibuprofen, you know, 3 times a day, 800 milligrams, 3 times a day.
800 milligrams 3 times a day.
Yeah.
For how long?
Months.
Months. Yeah. So I bet your stomach is probably happy.
It's probably happy. Yeah.
Yeah. And so, you know, it's interesting because just less than a month ago, you were in a state where you thought potentially, you know, you were in such disrepair that you were getting all the thoughts like, I'm never going to get better.
Oh, I truly believed it. I thought I would never be a functional human being again.
Yeah.
And we canceled our trip to Europe, I told you.
Yeah, you had to cancel a trip, but now hopefully you're going to be able to start to schedule one again.
Oh, yeah.
Yeah, you said your kids are finally grown, and you and your husband are looking forward to like having some you time and taking some cruises once, you know, a couple times a year. And it's just amazing because, you know, a lot of the people that I've done videos with recently that get such rapid recovery, they're younger, but this shows you that it's not limited to age. Of course, as we age, our general ability to heal becomes a little bit slower. However, you know, when I show the curve here, we're going to show pictures of your curve. I mean, your curve was what I would consider really bad, really bad.
Yeah.
Signs of C0 and C1 hitting together. You know, 3.5 plus millimeters of instability to one side of C1, C2, over 3 to the other side. I mean, this could have been a case where potentially it could have taken you a year to recover, and could have been, you know, in theory, it could have been very, very costly as well. And so I think that it's interesting because you did all the right things. You know, you tried with gentle, specific upper cervical chiropractic, which very often can fully resolve many complex neurologic issues. And when that wasn't holding, you know, you went to what I feel should be the next step, which is working on curvature and stability through something simple that's relatively low on the invasive scale and relatively affordable on the grand scheme of alternatives, such as tendon dry needling and some of the very superficial ligaments we may target. And you've gotten, in 3 weeks' time, you've gotten, can I say, like your entire life back?
Oh yeah, I'm like a totally different person.
Yeah.
And I would like to say too that I have had dry needling before, and your approach is totally different.
Yeah.
Totally different.
It's just targeting, you know, I first took acupuncture when I was still a student in chiropractic school. And in Florida, however, I just used tendon dry needling. And I took dry needling coursework probably 7 years ago through Myopain Seminars, which is like the offshoot of the founder of dry needling, Janet Travell. She was a medical doctor. She was John Kennedy's physician, you know, really brilliant lady, lived to be over 100. And she found that just using the needle, she could bring healing, because Kennedy had a lot of myofascial pain. If only she knew also to treat the tendons, he may have even felt better while he was still alive. But when you bring strength to the tendons with a very specific way of irritating the tendon just correctly, the tendon has abnormal nerve growth in it, it has abnormal blood vessels, and you kind of stimulate the body to remove those and build back really strong tendon. When that happens, the muscle can relax, it can elongate, your body can remove nervous system tension, it gets rid of sympathetic little nerves that grow in there, so your body's constantly in this fight or flight, and then your vagus nerve is working overtime, and then you get, you know, way more acetylcholine release, and I can't break it down, and it gets, you know, it just is this whole sequela that can breed nervous system dysfunction. And I think that it's just, it's painful, but it's relatively low invasive scale. You don't bleed, you might get 1 drop of blood once in a while.
It's totally worth it.
Yeah. And so, yeah, just 3 weeks. I guess, you know, it's just an amazing story just to show how quickly that you could be teetering really on a path where you could have fallen into disrepair and been stuck in that negative mindset, not able to, you know, be part of your family in the way you wanted to be, you know, not be able to do things with them. And now you're back, you know, 100%. So
yeah, I'm so grateful. I literally prayed for God to send me to the right person, and He sent me to you. And
amazing. Yeah, it's been a pleasure to work with you and help you. You and your husband Ron are just amazing people, and I think that the main thing we're going to have to do in order to prevent this from reoccurring is just continue to solidify that curve. Your curve was so far forward. We've gotten it a little better already, and we'll show some images how it started to pull back. But in order to really keep, you know, the stretching from happening again, is we're going to have to really continue to optimize that curve. And
I'll do the work.
Yeah, you've done amazing. You know, that's a perfect story. It's a perfect story to share. Is there anything else you want to share, or do you feel like you've gotten your I think you've gotten it out, but
yeah, I think people should just try it, because it really works. And like I said, your approach is different, because I've had dry needling before, and
it's been, you know, for 9 years, almost exclusively what I've focused on is the people that are left behind. And I mean this, you know, I constantly couldn't sleep at night, or, you know, not really. I mean, I sleep well, but before I'd go to bed, I'd be sitting there thinking about the one person that week that didn't fully get better. And then what could we do to help them? What could we do to help them? It led me down a path to constantly pursue getting around the most brilliant doctors that I could, and just learning from them and trying to adapt and mold my technique. An interesting point here to make would be that people with chronic migraines, people with chronic head pressure, you know, anxiety, were those kind of the main symptoms for you? And then the shakes, right, when your nervous system would go on overdrive. That for not for everybody, but for many of you, there probably is a way that you can either significantly reduce your symptoms or maybe even eliminate them. I mean, Shannon's on day 12 of not having to take a kind of like a rescue medicine. And I mean, honestly, I don't feel like, you know, we're gonna probably need her. She's on that, you know, as needed. It's her doctor said, when you have a flare, you can take this. I don't really see the fact that you're gonna have to, you know, go back to that. So it's really amazing.
Yeah, I'm so happy and grateful, and so glad I came here.
Yeah, well, I feel like your story is definitely gonna inspire at least a few people to try to reclaim their health, and just to, you know, life is not about the years you live, it's about what's within those years.
Absolutely.
And so if we can just help even a few more people through the reach that this video gets to seek more permanent solutions, and to be able to reclaim vitality, to be able to, you know, enter it back into their community, into their family, into a work that they feel provides meaning, then I think we've done an amazing service. So
absolutely.
Thank you so much for sharing your story. And
thank you. Thank you for helping me.
It's my pleasure. Thank you, Shannon.
Thank you.